Hi gang, today we are going to cover prenatal development, which is considered to be earliest development. On average, a typical pregnancy will last for 40 weeks, and we call that 40 weeks of gestation. However, there are definitely variations in that, but for our purposes, we're going to talk about typical gestation. The prenatal period is broken down into 3 stages, which I'm going to describe to you in just a moment. If you go into our Blackboard course shell and you go to Content, go down to Unit 2, and there's a video in this folder called 9 months in the womb. So please watch this video so you can really see how development takes place prenatally throughout those 40 weeks or 9 months. So after the sperm fertilizes the egg and conception or fertilization takes place, a new cell is formed, and that is called a zygote. At that point, the beginning of prenatal conception starts with the germinal stage, and this stage lasts about 2 weeks from conception to implantation. That zygote, that single cell starts the process of cell division and starts doubling and doubling and doubling. That bundle of cells is initially called the blastocyst, and then an outer layer of the blastocyst, the trophoblast, creates 4 membranes, and these 4 membranes start to produce blood cells for the growing individual. It also forms the umbilical cord and the placenta, as well as the amniotic sac and the chorion. The umbilical cord is what connects the growing embryo fetus to the mother, and that is connected to the fetus and to the placenta. The placenta is what allows for the exchange of nutrients and wastes from the mother to the infant and vice versa. The amniotic sac is a kind of like a shock absorber, and it provides protection for the growing embryo and fetus. And it also helps to maintain temperature. And eventually, the fluid that is in the amniotic sac, the growing fetus will start taking in the fluid and kind of like practicing breathing, if you will, and it helps to build lung function. The next stage of prenatal development is called the embryonic stage. Now, the embryonic stage begins with implantation. So, as mentioned earlier, the germinal stage lasts about 2 weeks. So it takes about 2 weeks for that zygote and blastocyst to make it to the uterus and implant. And once that bundle of cells implants on the uterine wall, it enters into the embryonic stage, and that bundle of cells graduates to the status of an embryo. It's important to note that approximately 60% of natural conception actually fails to implant, and a pregnancy does not sustain or occur. However, when it does, there's a lot going on in the embryonic stage. So the embryonic stage lasts for about 8 weeks, and this is the stage where the major organ systems are developing. In fact, 22 days after conception, the neural tubes begin forming, which makes up the brain and the spinal cord. And by the 7th week after conception, sexual differentiation begins. And basically what that means is that based upon that X or that Y chromosome that sperm passes down, there will be the presence of androgens, which are male sex hormones, which will then guide the production, the formation of a male reproductive system and organs. Or if the Y chromosome is not there and the X chromosome is there, the embryo will develop into a female and develop female reproductive organs and a female reproductive system. The final stage of prenatal development is called the fetal stage, and this is around 8 or 9 weeks to birth. And during this stage, we see that further maturation of the major organ systems and the extremities and the limbs and the facial features. We see very dramatic gains in size in the fetal stage of development as well. An individual or a fetus has reached what we call the age of viability, meaning that it can has the possibility of surviving outside of the womb anywhere between 22 and 26 weeks. However, as you may imagine, if a fetus is born that early, they are at a very high risk for complications, abnormalities, because their organs, although they are maturing and they're more developed than the embryonic stage, they're still not completely developed. Good prenatal care is absolutely essential during the prenatal period, and there are many threats to development during this period. Teratogens are factors that contribute to birth defects, and teratogens come in all shapes and forms. It could be things that are environmental, pollutants, exposure to environmental toxins, to radiation, maternal diseases, maternal infections, stress, exposure to various types of diseases or infections as well, high levels of mercury, exposure to lead. There are numerous things that can impact the prenatal environment and hence affect the prenatal environment. And teratogens are all impacted by the type of exposure, the amount of exposure, the point in prenatal development that the mother and or fetus is exposed. Genetics play a role as well, and being male or female can also impact how teratogens impact the prenatal environment. Please go back to the Unit 2 folder in the content section of our Blackboard course and scroll down to a presentation on teratogens and their impact on development. Please review this material. This presentation will give you more information about the impact that specific teratogens have on the prenatal environment. This presentation will specifically look at alcohol and drugs and other types of teratogens and how that could impact the growing embryo and fetus. Prenatal screening tests are definitely a set of procedures that are performed during pregnancy on expectant mothers, usually to determine whether or not the baby is likely to have specific birth defects. Most of these tests are non-invasive, and they're typically performed during the first and second trimesters, although some are performed during the third. Important to note is that a screening test can only provide the risk or the probability that a particular condition exists. If a screening test shows positive results, then diagnostic tests can provide more definitive information. Some prenatal testing is routine. Expectant mothers will have what they call a glucose tolerance test, which checks for gestational diabetes. Women who have higher risk of having a child with certain conditions, they may be provided additional screening tests. For example, pregnant women who lived in regions where tuberculosis was common, they should have a tuberculin skin test. First trimester screening tests can begin as early as 10 weeks. It's usually a blood test and an ultrasound. These test your baby's overall development and check to see if the baby is at risk for developing any type of genetic conditions such as Down syndrome. And it also checks the baby for heart defects, cystic fibrosis, and other developmental problems. Second trimester screening tests occur between weeks 14 and 18, and it could involve a blood test, which will also test whether a mother is at risk for having a child with Down syndrome or any neural tube defects, and an ultrasound is typically done at this time as well. An ultrasound uses sound waves to create an image of the baby in the uterus, and the test is used to determine the size and the position of the baby to confirm how far along the expectant mother is in her pregnancy, and to also find any potential abnormalities in the structure of the baby's bones and organs. During the second trimester, a more detailed ultrasound may be used if there's any concerns. It's called a fetal anatomy survey, and it's used to evaluate the baby carefully from head to toe for any birth defects. However, it's important to note that not all birth defects are going to be visible by an ultrasound. The blood test that I referred to in the first trimester, there's two that are typically used, and they essentially measure the levels of certain substances in the blood, specifically something called pregnancy-associated plasma protein A, and a specific hormone called human chorionic gonadotropin. And if there were abnormal levels of these particular proteins and hormones, it indicates that there might be a chromosomal abnormality. The blood test that you're given during pregnancy also helps to determine your blood type and the Rh factor, which determines your Rh compatibility with your growing fetus. You can be either Rh positive or Rh negative. Most people are Rh positive, but if a mother is found to be Rh negative, her body will actually produce antibodies that will affect any subsequent pregnancies. When there is an Rh incompatibility, most women will be given a shot of something called Rh immune globulin at 28 weeks, and again, a little bit after delivery. Another type of procedure is called chorionic villus sampling, and this is an invasive screening test. It involves taking a small piece of tissue from the placenta, and it's usually performed between the 10th and the 12th weeks. It's used to test for genetic abnormalities like Down syndrome and birth defects. There's two types of these. One type tests through the belly or the abdomen, which is called transabdominal test, and one type tests through the cervix, which is called a transcervical test. There are some side effects of this testing: cramps, spotting, and there is a small risk for miscarriage. Another type of prenatal test is called procedure is called an amniocentesis. And during an amniocentesis, amniotic fluid is removed from the uterus for testing. Amniotic fluid is the fluid that surrounds the baby during pregnancy. It contains fetal cells with the same genetic makeup as the baby, as well as other chemicals that the baby's body produces. There are several types of amniocentesis. A genetic amniocentesis tests for genetic abnormalities, such as Down syndrome and spina bifida, which is a neural tube defect when the neural tube doesn't form completely. A genetic amniocentesis is usually performed after week 15 of pregnancy. Someone or a doctor may recommend an amniocentesis if a prenatal screening test showed any type of abnormal results. If the expectant mother had a chromosomal abnormality during a previous pregnancy, if the mother is 35 or older, if there's a family history of a specific genetic disorder, or if you or your partner is a known carrier of a genetic disorder. Another type of amniocentesis is called a maturity amniocentesis, and it's performed later during the third trimester to determine whether or not the baby's lungs are ready for birth. And this is only done if a planned early delivery through either induction of labor or a C-section is being considered for medical reasons. So this test is typically done between weeks 32 and 39. It's important to note that both the amniocentesis and the chorionic villus sampling are not routine prenatal tests. Not every expectant mother will have these tests, and the expectant mother can elect not to have the test even if a doctor recommends it. So it's not something that has to be done, nor is routinely done. But if they are done, and there is some concern that results from the testing, diagnostic tests are the next step after a screening test. They will yield a positive result. They leave virtually no doubt as to the existence or absence of certain birth defects. And these diagnostic tests like amniocentesis and chorionic villus sampling, they're definitely more invasive than the screening, like the blood test and the ultrasound. There are several complications that could arise from pregnancy. Minor complications include things like nausea, heartburn, gas, backache, insomnia, constipation, shortness of breath, varicose veins. Those are minor complications that can be very uncomfortable and unpleasant for an expectant mother. But typically, they will not have an impact directly on the prenatal environment. It's important that a expectant mother, if she is experiencing any of these minor complications, that she speak with a doctor before taking anything to relieve any of this discomfort, and making sure that everything that she is taking in will be safe for the growing embryo and fetus. Major complications include things like an ectopic pregnancy, where the zygote doesn't fully leave the tube, the fallopian tube, and starts to develop more in the tube versus making its way to the uterus. This can be very dangerous for the mother. Also, toxemia and preeclampsia, which is marked by high blood pressure, can become a major complication that could pose a very high risk for the mother and the baby as well. It could lead to maternal mortality. And the last is spontaneous abortion. And this is when the body aborts the baby due to chromosomal abnormalities. And typically this will occur before 12 weeks. So next we are going to talk about birth. So stay tuned as we talk about the methods of childbirth and the different stages of birth and what happens before, during, and after the birth of a child.